Thank you so much. And thank you, everyone, for being here. I'm super excited. This is one of my favorite topics. So, we're going to talk about a multifaceted approach to optimizing gut brain health. So, Lexi already gave me a great introduction, but I have been in the field for so long, and some of my personal experiences and professional experiences have gotten me to this point. Losing my brother to cancer and recognizing that life and health is such a gift, getting cancer myself and realizing that I really had to optimize my health through functional medicine afterwards. And of course, gut health to really prevent any future reoccurrences. But I've also really dialed in a lot of aspects of nervous system health and appreciating trauma and having a trauma informed approach with every person that I work with. So, my goal today, as we tackle this amazing topic of gut brain health, is to weave in a lot of different practices and philosophies from Eastern approaches to Western approaches. I do visceral work, pelvic floor work, craniosacral. I incorporate mindfulness and vagus nerve health. And so, we're going to incorporate a lot of these different aspects to really consider as you're approaching your complex patients with gut and brain issues. So let's dive in. We're going to talk about the four different pathways of gut brain communication and the strategies for how to modulate them. We're going to discuss stool testing and nutrient analysis and how we can really influence gut brain interactions and individualized treatment approaches, which, if you've worked with a lot of people with anxiety or depression or other mood disorders or have very complex gut issues, we all can appreciate that each individual approach is necessary. And quite frankly, for my patients, it all looks different. There might be some similarities in what we're treating, if it's a pathogen or if it's dysbiosis or leaky gut. However, the reason that patient got there might be completely unique for each of them. I'm hopefully going to provide some insight into combining the impact of nervous system techniques, including dietary changes, mindful movement on gut brain health. And also, we're going to touch on some visceral mobility, lymphatic drainage, and ways that you can help enhance your gut treatment protocols. As Hippocrates once said, all disease begins in the gut. And I think that this is such a powerful quote. And it's something that we are going to really tackle today. But there's so much information that is coming from the gut to the brain and vice versa, that it is such a powerful way to be able to begin to create healing in our patients and hopefully empower them to thrive. So we've all, I'm sure, experienced a little bit of butterflies in our stomach, a gut feeling. And I think that's such a beautiful representation of just recognizing that connection. Sometimes when I'm explaining it to a patient, I might use this as an analogy and say, have you ever felt this before? And it just gives them that moment of awareness of how powerful this connection is. And we'll dive into all of those reasons. So we know that from a gut brain axis, it's this amazing bidirectional communication that has multiple pathways that are affecting hormones, nervous system, metabolism, and immune system. And ultimately, if we're really simplifying it, we're thinking that our goal is to provide normal gut function and also appropriate mood and behavior. So, with the four different pathways, I think that the best way to really tackle this is to look at how we have top down pathways, we have bottom up pathways, we have direct pathways, and we have indirect pathways. And with some of these, we have the nervous system, including the enteric nervous system and the vagus nerve. We have the neuroendocrine and HPA axis. We have the immune system, and then we have the microbiota derived neuroactive compounds. But I think a better way to think about this is that it is really ever evolving, that there's so much communication that's going back and forth all of the time from our neurons, from our hormones, from so much information, our lymphatic system, immune system. So we want to be thinking as this ever evolving process all of the time. And that's why it's so important to address both aspects from the nervous system as well as the gut. So let's talk about the neural connection first, which is one of my favorites because I love talking about the vagus nerve. So we have the enteric nervous system, which can operate as its own nervous system, which I'll touch on in a second. We have the vagus nerve, which is going to be the superhighway between the gut and the brain. We have interoception, which is our internal awareness of self. We have 80% of the information, this afferent information, so going to the brain. and from the gut. And we have this abundance of sensory fibers that's conveying this sensory rich information about our viscera all of the time. And ultimately, this vagal activity is going to be sensitive to nutrition, to exercise, to stress, to our toxic relationships, and so on. So let's start with the vagus nerve. So we want to recognize that the vagus nerve is a pair of cranial nerves. So it's the 10th pair of cranial nerves, and it's 80% of our parasympathetic or rest and digest system. It's our wandering nerves with our longest cranial nerve, and it is craniosacral. So we, as a craniosacral practitioner, I love incorporating this technique into helping bring balance and homeostasis to someone's system, because it truly is coming from the cranium to the sacrum, and this, again, constant communication between the two. And ultimately, his role is to provide us homeostasis, is this internal balance. And as I mentioned, we have 80 to 90% of this information, this afferent information, going to the brain. So that is going to influence things like if we are inflamed. So if there's dysbiosis, if there's leaky gut, if there's feelings of hunger, if there's feelings of fullness, our energy metabolism. But we also have some efferent information that's coming from the brain and from specifically the brainstem. And so that is secretion of gastric acid, digestive enzymes, our gastric capacity. So if we have a psychiatric issue, whether that's major depression or anxiety, PTSD, that is directly influencing the gut, but also conversely, anything that's happening at the gut level is going to be influencing the brain. And so much of this is affected by and transmitted by the vagus nerve specifically. So I love talking about the polyvagal theory, and I'm sure so many of you have heard it and use it, but I'm just going to take a minute to touch on it because it's been such an important part of my practice in helping patients, especially with extremely complex health issues, really get to the bottom of their issues. And as soon as I begin to pull this picture out and show them, they immediately resonate with where they are in their nervous system and hopefully how to change that. If we're thinking of Dr. Stephen Porges' work as how our nervous system expresses itself, if we are in that state of social engagement, so if we are connected, we're grounded, we're mindful, we're curious, then from a physiological standpoint, we are optimizing our digestion. We are optimizing our immune system, our ability to relate and connect, our oxytocin. And when we're in that fight or flight state, that could mean that we're multitasking at work and our cortisol is increased and we're trying to eat our lunch. And we might be worried or concerned that we still have so much to do, but we're trying to make time to eat. And in a situation like that, worry and concern will continue to, as we have more arousal, it continues to increase. It might turn into anxiety or fear or panic. Just if we are frustrated, it's going to eventually turn into irritation or anger or rage. And so we have this opportunity to identify what state we're in and to be able to shift our state. Because in that fight or flight, that's when digestion decreases, our motility decreases, our heart rate increases, and so on. So if we're trying to help someone truly heal from within, then we have to recognize where they are in their nervous system at all times, at every session, every time we connect with them, because things can change all of the time. So the third state would be our free state, our dorsal vagal state. So the most primitive pattern where we can be disassociated, we can be shut down, overwhelmed, numb. And this is also a state where we could be in a functional freeze. So we could have, let's say, we are able to do what we need to do in terms of work, but unfortunately, we're still disassociated, disconnected from ourselves. This is also a trauma response. And so when someone's experienced significant trauma, they're going to be procrastinating and they always say, I should, but they're never really able to do it or execute. And physiologically, so many things are happening here. So this is such a vital part, in my opinion, to understand where someone is at in their journey, and really be able to factor this into each and every session and their subsequent treatment plan to really help them heal their bodies. So As we talk about the enteric nervous system, what's fascinating about this is that it has its own independent peristaltic reflex, which is our gut movement. It has its own immune system function. It's able to segment food and mix food without moving it forward. It's able to optimize the migrating motor complex, so that wave like action pushing bacteria through to the large intestine. It's able to manage nutrients and local blood flow. So it's really fascinating in and of itself as its own nervous system. What I love touching on as it relates to this is interoception. So the vagus nerve is actually the key to our interoceptive system. And we want to think of our interoceptive system as our internal awareness of self, as I already mentioned. So in our viscera, we have tons of interoceptors. And all of this is directly linked to the anterior insular cortex in our brain that is linked to emotional regulation. So 80% of our peripheral nerves in our fascia are free nerve endings, and 90% of our free nerve endings are interoceptive. So we actually have 7 more times interoceptive receptors than we do proprioceptive nerves, which is fascinating. So this is one of the many reasons why we can be sensing so many things in our viscera, and that's constantly communicating with our brain. And it's an opportunity for us to be able to help people improve their interoceptive skills. As an example, and you can test this on your own, maybe not right now, but you can try to detect your heartbeat without actually taking your pulse. And then you can take your pulse. So you could do it for ideally about a minute and compare it to you actually taking your pulse and see how close that is. And that can give you a sense of how interoceptively aware are you. It's one example, it's not everything, but it does give you a sense of where some people are not connected at all and some people are overly connected. So they feel everything. So this is a really great concept and something that we can help really maximize with our patients and clients. And again, this bidirectional exchange between the gut and brain and through this interoceptive processing is ultimately affecting our emotion, our cognition, our beliefs, our decision making, our memory based on this interoceptive feedback of, are we hungry? Do we have to go to the bathroom? Or how are we breathing? Is our heart beating fast or slow? So lots of really amazing information that's being exchanged bidirectionally that can affect our ability to optimize our gut and brain function. So we're going to move into a couple exercises, and I love doing a lot of vagus nerve hacks, and I call them hacks because I love to make them accessible for you and for all of your patients because it's a fun way to connect with your nervous system. So we're going to start with a humming exercise that is by Lois Laney. So she is a doctor that is specializing specifically in sleep medicine, but also cranial nerves. And this particular exercise, just to give you an example, I had a really amazing case where a lady was throwing up every day for 10 years. She had her gallbladder removed and she would wake up, brush her teeth, and throw up every time she had her hyperactive gag reflex. So the first day we implemented this technique before we implemented any other gut treatment protocols, such as including bile acids and so on, nutrient optimization. And within 1 day, she didn't throw up and she never threw up since then. I'd love for you to do this with me. So I'll just talk through the exercise quickly and then we'll do it together. So how you perform it is you want to think tongue at the roof of your mouth. So that would be our resting tongue position for breathing. We're going to breathe in naturally through the nose, breathe out through the nose. Okay. And then right at the bottom of the exhale, so you're not going to take another breath in, you're going to hum as loud and long as you can. And at the very end of the hum, before you take a breath, you're just going to hold that until you swallow. Okay. And then my only tip is you just want to make sure you're looking forward, not looking down. Look, you're just trying to keep your vision at the same place the whole time. So I'm going to talk you through it again. So tongue at the roof of the mouth, making sure you're just sitting up nice and tall. I'm going to have you take a breath in through the nose, breath out through the nose. As soon as you finish, you're going to hum as loud and long as you can. And then as soon as you finish your hum, however long or short it is, you're going to just wait patiently for your swallow. I won't have you hold it too long, but you're just going to wait. And just a quick reminder that you are safe, you're good, you're here with us, and you feel connected to the chair. If you feel like it's starting to stress you out, you can absolutely start to breathe normally. You can do that at any time, but just patiently wait for that swallow. And feel free to drop in the chat if what your experience with that was. Was it really stressful? Really easy? Did it feel good? And it could be all of the above. And what this is a neural resequencing pattern that can help to really reprogram the pharyngeal branch of the vagus nerve. And it is really powerful, but it is something that needs to be trained over time, because what will happen is anyone that has a swallowing issue or hyperactive gag reflex, this could be extremely powerful. Anybody that's experiencing GERD, this can be really helpful. Okay, so I'm going to move on to the next one, but feel free to drop in the chat what your experience was. So the next one is the salamander. So if someone is experiencing a lot of airway issues, for example, most people do have an airway issue, which is going to cause them to be in a constant fight or flight. If they're in constant fight or flight, then they are not going to be optimizing their gut health and their digestion. So the salamander, I'm going to have you turn to the right and turn to the left. Just get a sense of, what does my neck feel like today? Does it feel tight at all? Then I'm going to have you interlace both hands behind your head. And from here, I'm going to have you side bend your upper body, and you're going to look with your eyes the opposite direction. So when you're doing that, you're just going to hold that for about 30 seconds. So your eyes are, again, looking up, maybe towards the elbow, face stays forward. We'll do an abbreviated version today. We'll come back to center, and we'll come back to the other side. So side bend your upper body the other way. Face is forward. Look up with your eyes towards the elbow, the top elbow. Good. Then we'll come back to center, and then same thing, just turn to the right and left, see how that feels, and see if that feels like an improvement. Once again, feel free to add in if it does, if it feels better. Typically on most people, it's going to feel an immediate improvement. So the neck, and so what we're doing there is using the input of the neurological input of the eyes and the hands to bring blood flow around the brainstem. And then we're also actually stimulating the spinal accessory nerve, which is going to relax the neck immediately. So anybody that's having this chronic tension or airway issues or lymphatic issues, this is a really great technique. Breathing before eating is probably one of the basic ones, and I'm sure everyone is encouraging their patients to do that already. But because it's basic, it's worth reinforcing. And that's such a simple way, because we want to think of the vagus nerve as passing right through the diaphragm. So as we begin to do that slow, deep breath, we're going to create the relaxation response, increase ACH, and really optimize bringing blood flow to the digestive tract. And then the last one I'll mention is a gastroesophageal release. So this is a really great one for anybody that's experiencing GERD or any upper GI symptoms, even some stomach issues. So hiatal hernia, there's a specific technique for this, but you could also use this as well. So if you walk your hands down and you're coming right down the sternum to the bottom of the sternum, and you would have the xiphoid process, so right at the bottom there. And you're going to go just a little bit below that and to your left, that's also the gastroesophageal junction is also called the cardiac sphincter. So from here, it's about a nickel size. So you can envision that. It's around the level of T10, T11. You're going to gently compress it. And then I'm going to have you just gently pull down and to the left as you do that. So very nice and easy. This is a gentle technique. And from here, we would wait for a lot of the vagus nerve exercises. We might wait for a sigh, a swallow, a yawn, a sign of relaxation of the nervous system. You also just might feel relaxed, or your symptoms go away. So this would not be recommended to do when you're eating or if you just ate, but you want to do these around meals. This can be a really nice adjunct, because oftentimes when we're treating the gut for whatever might be happening, maybe it's H. pylori, maybe it's some other infection, we also want to appreciate all of the physical things that are happening in the viscera. Okay, so now we're going to move into, and feel free to jump in and say how that felt for you as well. So for the neuroendocrine, which is the second pathway we'll talk about, we want to think of the top-down pathway and the bottom-up pathway. So from the top down, we're thinking of how cortisol, or stress hormone, is going to influence that microbiota composition. increasing that bacterial colonization. We have the bottom up pathway, which think of the gut epithelium, hard to say fast, is influencing our hormone secreting cells. So in this case, we have our K cells, our L cells, our I cells, our G cells that are all creating these really important responses from a neuroendocrine. And when we think of endocrine, most often it's influencing something distant, but we also want to think about its local and distant effect that it might be having. So K cells regulating insulin, the L cell secreting GLP-1, PYY, inhibiting GI motility, increasing satiety. Our I cell is going to secrete cholecystokinin. So all of these are having this really important role. G cells are going to release gastrin and stimulate gastric secretion. And then, of course, our most popular one that we're talking about right now is GLP-1. And so that's that incretin hormone that we have receptors in the brain, intestine, and pancreas. So what's fascinating about this as an example is the influence that it's having from the brain down and from the gut up. So via this neurostimulation pathway. So it just is yet another example of how powerful this connection and communication is all day long, every day. And that, of course, is helping to regulate appetite and lower glucose, slow gastric motility. It's at the level of the gut, it's creating the gut distension, but at the level of the brain, it's increasing satiety. And then we have something like ghrelin, so an appetite regulating protein, which is a slow pathway, but it's unique in that it's rising before meals and dropping after eating. And it is helping with glucose homeostasis, energy balance, central nervous system. And in this case, it's indirectly interacting with the central nervous system via the vagus nerve, or it's directly interacting with the brain over the blood-brain barrier. So this is where we start to get really unique interactions of direct, indirect, top-down, bottom-up. So another great example. And then we have our short-chain fatty acids. So in this case, we have the short-chain fatty acids that are basically promoting indirect signaling to the brain via systemic circulation or vagal pathways. And they're doing this by secretion of, yet again, gut hormones. So in this neuroendocrine pathway. So serotonin, GABA, GLP-1, and PYY. And this is a really good visual of when we're thinking of these short chain fatty acids. It's also a reminder to think, why do we need more complex carbohydrates and great fiber sources to influence the microbiota to ultimately produce these short chain fatty acids that are influencing our gut and brain in various ways. So you can see all of the different influence that it's having via the portal vein, the hormones, our immune system, the vagus nerve. So a lot of communication that's happening via the ingestion of short chain fatty acids in our diet, right? So we always want to come back to that. So now we'll move into the top down of the immune system. So we've already touched on this, but as it relates to the HPA axis, so our hypothalamus pituitary axis, we have cortisol that's directly affecting our immune cells. So this is going to increase the secretion of cytokines, both locally in the gut and systemically. And ultimately, the longer that we're having increased stress, unfortunately, we're going to have increased gut permeability or barrier function, and it's changing our microbiome. We also have in our brain, if we have interleukin 1 and 6, that can contribute to an increased release of cortisol, which is ultimately creating this downstream effect. So when we talk about stress impacts our gut, we say this all the time, and patients, quite frankly, know this. They don't really know how, but they do, I think, a lot of times understand this because they're much more educated, is that stress and depression can reshape the bacteria composition through hormone shifts, through inflammation, through autonomic alterations. And ultimately, it can potentially decrease the beneficial bacteria and increase the opportunistic bacteria. It can also release metabolites, toxins, neurohormones. So all of this can change our eating behaviors and mood. And I think this is really a fascinating area, is just how we're eating and how there's so much information that's happening in our gut that it's taking in based on every little thing that we do, what we drink, what we eat. If we have more sugar, we want more sugar. And there's so many aspects of nutrition and food as it relates to what our gut is telling us and how we are ultimately making behavior changes because of it. Maldigestion is one of the biggest things that I see as it relates to stress and some type of gut issue is that I just see this repeatedly over and over again as I see it in the stool test, but I also just see the behaviors related to eating and that we're always eating in a stress state. So in this case, they're going to have their bowels are going to be off, right? So the last thing would be is altered intestinal permeability, so leaky gut. So also when we're thinking a bottom up from the immune system, we want to think the gut microbiota is going to affect the innate immune system of the brain. Intestinal cytokines can affect the brain via systemic immune system. And then we have lipopolysaccharide and cytokines in the gut that, so if we're thinking increased intestinal permeability, increased LPS, then we have poor barrier function, which can cross the blood-brain barrier and create inflammation in the brain as well. So a lot of possibility here as it relates to the immune system. And one of the areas that I'll move into is how we can begin to integrate this into our approach to treating and healing the gut and the brain is the lymphatic system. So 70% of our immune system is in our gut, and that's via the gut-associated lymphoid tissue. So this is part of our adaptive immune response to gut antigens, and it's one of our largest immune organs. And when we look here, we can get a good visual of on the right side is the HPA axis, and we could see how this is creating this downstream effect on our immune cells and ultimately on our gut lining. But then conversely, if we look at the left side, we can see how the gut microbiota is affecting the hormones, it's affecting these neuromodulators and neurotransmitters. It's how it's affecting our serotonin, right? And all of this is communicating via the vagus nerve. So really powerful interactions. So one of the things that I always find with patients that are dealing with a lot of complex health issues, of course, the gut being part of it, is that they have so much lymph congestion. And that might be very obvious. So they have poor capillary refill. They have swollen hands. They have swollen lymph nodes. They have puffy ankles. But it also might not be that at all. It could be that they have painful tissue. So when we are feeling, let's just take an example and everybody can try this, is as you come down along your sternum, it shouldn't be painful there. And when you start to feel there's a ton of lymph here, when you start to palpate around the abdomen, it shouldn't be painful there. If you're in your armpit, your axilla, it shouldn't be painful there. And so when we start to see this painful tissue everywhere, we know that's not healthy, that there's some lymph congestion. And so a lot of times when I'm measuring it, I might do circumference measurements, I'll do capillary refill. I also do neurological testing to just really get some objective measures of it. But we want to think about what are the two things that move lymph is diaphragmatic breathing, which most people have an airway issue. So one of the first things to address is teaching someone, taking the time to teach them how to diaphragmatically breathe properly. And so we'll just do that together really quick. So we want to think tongue at the roof of your mouth, touching your top teeth. So that should be the resting position of your tongue that should be there all day, every day, unless you're talking or eating. Definitely when you're sleeping. And so when you breathe in, you want to feel like your neck and shoulders are totally relaxed. And you're breathing in and think 360 degrees of pressure. So it's not just a belly breath. That's what we normally say, but it's not just a belly breath. You want to feel the side of your rib cage expanding, the back of your rib cage expanding. You want to feel like the pressure is going all the way down to the pelvic floor. And when we can really optimize diaphragmatic breathing, one, by teaching someone how to breathe properly, but two, addressing their airway, because most people have an airway issue. So whether that is a nasal obstruction, whether that is jaw issue, maybe structurally they actually have a narrow airway, but being really in tune with, is this something that is super important for someone to have a sleep study? So I look at sleep studies all the time, and a lot of times it'll come back normal, but it's not normal at all. And we want to really understand, because if someone has gone through everything. I've done every gut treatment possible. I've been trying to heal my body. I've been to all these doctors, but we don't get back to the foundations of how are they breathing? How are they eating, of course? How are they sleeping? If they don't have the capacity to sleep well and truly restore, then that is the person that never seems to get better. So that's one. And then movement, we want to think about skeletal muscle contraction, respiratory motions, as I just talked about. And we also want to think about the importance of mobility and motility of the organs. So anytime we're getting inflammation in the gut and we've had surgeries, C-sections, we've had appendectomies, potentially a bowel resection, hysterectomy, we know that there's a ton of scarring, and that means that it's influenced the fascial tissue, i.e., mobility and motility of the organs, which means that has affected our lymph system as well. So when we're looking at the lymph system here, we want to think of, first of all, it's one of the most powerful yet neglected systems in the body. And it's working obviously in conjunction with the circulatory system. But we can see on that left side, that left subclavian vein, that's where the majority of our lymph drains. So that's where we're thinking about doing lymph drainage. We want to think about clearing that first so that we can really optimize our lymphatic system. And half of the lymphatic system is actually coming from the liver and small intestine alone. So in the cisterna chyli, I love doing really specific techniques to do liver pumps and lymphatic pumps that we can actually help to pump that fluid back into the cisterna chyli so that we can really optimize lymph flow and decrease some of the congestion that happens in the abdomen. So what can you do? Movement and breath, number one. Diaphragm releases. So that could be really specific work of coming under. It could be manually, or you can also do a lot of self techniques of how to really release the diaphragm, even just something as simple as a soft ball, like a rad ball or a courageous ball. And you can do really soft fascial techniques with just rolling over the intercostal area and the abdomen to really try to help with this motility overall. And then lymph drainage, I love doing a variation of techniques, but one of the things we want to think we're influencing it specifically is the mechanoreceptors in the skin. So one of the techniques, if you look at this picture, you can see all of the different circles, which would be your key areas of where you would want to target your lymph drainage. I love doing a feather light technique, then a faster, deeper technique, and then a little tapping, a little vibration. And then when we do that, we end up influencing a lot of these different mechanoreceptors, which is ultimately going to help to move lymph because the lymph is right underneath of that. So we would start with the left subclavian vein. Then we would go to the right subclavian vein. Then you go up underneath the jaw. So we're clearing the left first. Then we're going to go up under the jaw. And then you start to begin to go down the body in terms of all of the circular area. So the axilla and pec area, the abdomen, inguinal, inner thigh, popliteal space, and then inside the ankle. Then you can incorporate this is a daily routine, but then you can also help them with doing dry brushing. Maybe that's anywhere from 1 to 3 times a week, focusing on those circular patterns and really trying to optimize these same key areas, but just changing the technique. And so this is such a powerful way. If you're not doing this already with your patients, I always find that once I begin to implement this, that it makes such a huge difference on the trajectory of their healing, because you can't get well in the environment you got sick in. And then the other thing is I wanted to just point out an example of motility and mobility. So just using the pancreas as the example is, once again, as I mentioned, when we start to have inflammation and dysregulation in the gut, we're going to influence how these organs are moving. And they should be moving 1 to 3 centimeters and sometimes up to 10 centimeters with each breath. So in this case, if we're looking at the body and tail of the pancreas being more of the endocrine and then the head of the pancreas being the exocrine function, at the head, we have the sphincter of Oddi. And I'm just going to have you find that. So the easiest thing to do is come from the belly button. So you're going to start at the umbilicus. You're going to come up about 2 to 3 centimeters. Everybody's anatomy is a little different, so bear with me here. And then you want to think your right mid-clavicular line. So your clavicle right in the center of that. So you're coming over to the right. And it should feel like a pea. It's pea size, and it should feel hard, right? So a little bit hard. And that, if you can find it, hopefully you're pretty close to it. That is essentially, that is your sphincter of Oddi. So that is what's moving from the pancreas into the duodenum. And so for some of you that might feel really sore, it shouldn't really feel sore. You might feel an awareness, but it shouldn't feel really painful. And so I changed this order for you because you're doing it yourself. But if you press on it, and then as you release, if it's going clockwise, so you're clockwise from this orientation, then that would suggest that sphincter is not working as optimally as it can. So essentially, as you're taking off the pressure, if it feels like it's going to the right, not working as well. If it feels like it's going to the left, good. Okay, so you could try that a couple times. Feel free to jump in, and if you have any questions, I can always answer them at the end. But as an example, this could be one area that could be really optimized when we're thinking about pancreatic function and we're thinking about this influence of the organs and the lymphatic flow and the fascial integration and the interoceptors, right? So I'm trying to pull all these things together because so many people have such poor feedback all of the time, especially when we're thinking about anxiety or mood disorders. They're getting such poor feedback from their viscera all the time that once we start to optimize this, it can make such a huge difference. And the last pathway is the microbiota derived neuromodulators. So we always hear that that the gut is producing 3/4 of our neurotransmitters, so our chemical messengers, and 90% of our serotonin and 50% of our dopamine, GABA. So as I've mentioned, any gut issues, any infections, any inflammatory diets, all can influence our mood and behavior. And we want to factor in that although these neurotransmitters or neuromodulators are produced in the gut, we do want to recognize that there are some differences with what's in the gut versus what's in the brain. So, for example, serotonin can be synthesized from various bacteria such as Streptococcus, Enterococcus, Escherichia, etc. And that is going into the baseline pool of serotonin, but the serotonin in the gut is going to have a greater influence on the gut specifically than it is on the mood and behavior. Dopamine can be synthesized from lactobacillus, bacillus, morganella, and so on. And GABA can be synthesized from lactobacillus and bifidobacterium, where we often think of what would be referred to as a psychobiotic. So I did leave in for reference for you a few sheets of these of all of the different neurotransmitters, what are the bacterial strains, and the references here. So you can feel free to have fun with that. And then what we'll do is go through, let me just actually finish with this. So as it relates to the gut bacteria, we want to think of all of the functions of the gut. So from nervous system to promotion of bone density modulation, immune system, biosynthesis of vitamins, amino acids, metabolism of therapeutics, and so much more. So it's so important that we are always trying to optimize our gut bacteria definitely through diet, thinking of our short chain fatty acids, our fibrous foods, our fermented foods, which ideally we're trying to include anywhere from 4 to 6 servings, which really isn't a lot of fermented foods a day. I know that might sound like a lot for some of you, but a 1/4 cup or so. So if you are able to tolerate that, obviously a lot of our patients aren't, especially if they're dealing with SIBO, but ultimately being able to incorporate some of those can really begin to optimize some of our gut bacteria. So I want to just finish to tie everything together with a quick case study. So Ben was a patient I worked with, 53 years old. He's husband, dad of 3 boys, successful entrepreneur. He's in real estate. And when I saw him for the prior 6 months, he was having quite a bit of distressing symptoms. So he had COVID and he was reporting throat clearing, excessive mucus production. He had been dealing with heart rate spikes, withstanding. He was fainting. He had facial swelling, lightheadedness, blood pressure dysregulation, blushing, palpitations, and nausea. And on top of that, was very anxious, of course, about all of this and was hospitalized twice because of these symptoms. And with that, he really had no feedback to why this was all happening. So that's when I saw him, and he found me because of the vagus nerve specifically. And I just wanted to point out a few things from his stool test first, and that he had H. pylori. So H. pylori, of course, isn't an infection in and of itself, but it is also histamine producing. And he also had on his opportunistic bacteria on down to the right, he had streptococcus and staphylococcus, which is also histamine producing. On top of that, he had specific commensal bacteria that was low, including the Enterococcus and Escherichia, which are actually, remember, what we need for serotonin that's in the gut. He also was having a really poor time detoxifying, so his beta-glucuronidase was really high. He also had pretty significant antibodies to gluten, and then he also was not absorbing his fat, so his steatocrit was also elevated. So a lot of opportunity just from a stool test to understand a little bit what was happening. So we did some labs, and so what I was really interested in was histamine specifically. So what was because I was trying to put all the symptoms together of what I thought was happening. So we looked at tryptase, and that was pretty elevated at the time. So when we're differentiating mastocytosis versus mast cell activation, we're thinking mast cell activation would be an acute flare of it. And so at that time, it was pretty elevated. His D was extremely low, but I also wanted him to do allergy testing, which I don't have all of that here. But in the allergy testing, he was allergic to dog dander, and he had a dog. So that was one other histamine factor that we wanted to consider. Then his heart rate variability was tanked all the time. His airway screen showed that he had decreased tongue range of motion. He had significant forward head posture, unable to breathe nasally for 3 minutes, and a very narrow palate. So a lot of things going on from a airway standpoint and dysregulated nervous system. So after he was working with conventional medicine as well, but we determined that dysautonomia, specifically he had POTS, mast cell activation, and then proximal tachycardia. So with his treatment, basically, I wanted to showcase all of the things that, how would we put all of these things together in treating his gut and brain, because there was so much happening and so much that he could not really function in his day-to-day life. So we incorporated very specific vagus nerve exercises. So the salamander was really important for him because he had a ton of neck and airway issues. We did the Valsalva maneuver, which was really helpful for decreasing the tachycardia events. And then we did the version of the lowest breathing because he was having so much of the excessive throat clearing as well, and mucus production and so on. So that was really helpful to target that pharyngeal branch. We did daily lymph drainage. So we worked in progression. So I always tiptoe the system with lymph drainage, make sure we're accounting for detoxification and Herxheimer reaction. So we started to integrate that. We addressed his airway as best we could to using Xlear, which has xylitol in it, so it can help decrease the bacteria and keep the nasal cavity moist. And it can also improve airflow up to 38%, because when someone has an airway issue, again, that means they're going to have a sleep issue, and they're going to have a dysregulated nervous system and vagus nerve. So that means their gut function too. We did mutes, so nasal dilators, so we had them wear them at night. Diet-wise, we did modified elimination. We, of course, eliminated gluten because of his stool test. We did a low histamine diet as we were working on everything. We did nutrient optimization. We did increased salts to address the blood volume, improve orthostatic tolerance. Supplement-wise, we did diamine oxidase for the histamine foods. We did supplementation with bile salts to improve his absorption of things like vitamin D and fat-soluble vitamins. We did a combo in terms of nutrient supplementation. So we did microfactor, magnesium D3, and then specific botanicals. We use ashwagandha, stinging nettle, and quercetin to address the histamine overload. And then we did 2 different gut healing protocols. We addressed the H. pylori and immune system of the gut. We also did HCl because he was low in HCl. And we addressed some of the dysbiosis as well. And then just brought all of those things together. And so now it does not have H. pylori. His tryptase came down quite a bit. His D3 is normalized. And he feels great. He's not having any of those symptoms at this point, and he's back to working out, feeling great. So the last thing I just wanted to touch on is the influence of, because we cannot talk about all of this without talking about the influence of food and nutrition on our gut and brain. And so I love sharing these visuals with my patients because I think it makes it so much more impactful, is to say, okay, you're having some mood issues or you're having some gut issues and you're not digesting your food well and you're not having good gastric secretions. You're not sleeping well. So let's look at, what do you need to eat to be able to optimize your serotonin for you to feel good? And showing someone that we need all of these nutrients, just starting with protein, just to be able to make serotonin. And then we need serotonin and all these other cofactors to make melatonin so that we can optimize our sleep. And we could do this with everything. So with GABA, to decrease for him, he had so much hypervigilance, and so it was really important to incorporate all of the techniques. And I also actually referred him to a somatic therapist that's in my building because he had a lot of trauma that was unresolved as well. So there's a lot of layers to it. But really trying to address, what does he need to make stomach acid? So he needs specific nutrients for that. He needs zinc, he needs B vitamins. So really trying to optimize this. And of course, dopamine as well. So I'll leave those for your reference. And the last thing that we can include as it relates to gut brain health, not last, there's many things, but in this short webinar, would be something like looking at a more detailed test of a nutrient analysis, such as this is the NutriEval, which is really powerful to take it even a bit further. So how is someone absorbing their food? What are their organic acids look like, their metabolite? And being able to look at how these nutrients are affecting multiple pathways, not just one pathway, for example. And the same thing here. So is someone eating all of their amino acids on a regular basis? Where may they be deficient? Because so much of this is going to be dependent on optimal amino acid consumption. So in summary, so we want to think about so many aspects of a healthy gut-brain connection. And I think I've just scratched the surface today, but hopefully enough where you could take a nugget or two. So of course, limiting or avoiding any foods that you may be sensitive to, allergic to, or intolerant to as it relates to you or your patients. Taking antibiotics only when necessary. These are things that we know we're really familiar with. Really trying to maximize digestion, and that can take a lot of different levels. I sometimes, for a lot of my patients, will go as far as really try not to drink 15 minutes before, 15 minutes after, walk after meals, chew your food 20 to 30 times, do a somatic practice, then do your breathing before you eat. It just really depends on where they are, but this is a super important part of treatment. Increase fiber for short chain fatty acid production, increase diversity, whole foods, nutrient dense, probiotic rich foods when possible. And I think nervous system regulation is key, probably should be number one. But when I'm explaining to patients, again, with really complex issues, which is everyone, that we can't just treat the gut and we can't just treat the brain. I want them to understand from the very beginning that they are both so integral that we have to include both of them all of the time. The lymph drainage is also a really extremely important part of healing journey, and I try to implement that as soon as I feel like someone is ready. Optimizing tryptophan-rich foods, tyrosine-rich foods for serotonin, dopamine, exercise, which I didn't really have the opportunity to talk about today, but trying to use exercise as a way to enrich this microflora diversity, and continuing to help your patients improve their interoception, improve their awareness of self and how they feel and move through the world. All right. So I'm going to switch gears for a second, and I will promise I will open up the Q&A in just a moment, and we will I can answer any questions for you. But I just wanted to quickly touch on the mentorship that we offer here at Rupe University. So it is something we do on Tuesday at 11 a.m. Eastern Standard Time. And the mentorship is really designed to help you have this type of approach to working with your patients. So really looking at root cause medicine from the functional lab perspective, but also really trying to assess where someone is in their journey and what are all of the modalities, treatments that are going to be really helpful in making and helping them not only heal their bodies, but hopefully transform their lives and thrive. And we will dive deep into case studies. I love really making a lot of connections. So I love integrating the nutrition aspect, the functional medicine aspect, the movement, the airway, the sleep. That is what my favorite thing to do is to try to tie all these pieces together. So we will do that with every topic that we go through. We have a 30-minute one-on-one mentorship session per month. And then, of course, the opportunity to collaborate with amazing colleagues that are doing such great work. And so the purpose is really that we are just all becoming better clinicians, that we're able to, there's no ego, we're able to discuss cases, we're able to discuss testing, and really how we can make our patients really have the best outcomes, but also making sure that we're loving every moment of what we do. And here are some of the topics that we cover. So, everything from some business strategies, such as really having clarity on your purpose, mission, vision, avatar. Really making sure that's such an important part for me is that you're super clear in that because everything will show from that. And also things like building your brand on social media, depending on the setting that you're in. I think that's an important aspect, regardless of where you are or what you're doing. But beyond that, we will really dive deep into a lot of different medical conditions and treatment approaches. So, everything from navigating extremely complex patients, which is who I see day in and day out, to comprehensive nutrition evaluations, interpreting the lab testing and nutrition and therapeutic food plans, to really getting into breath body awareness, interoception, integrating movement for optimal health, and how you can easily integrate some of these things, even some visceral techniques and so on, into your patient's care, navigating immune system, cardiometabolic health, hormones, and so on. And we have two different options. So we have one is the Elevate, which is $245 per month. And so this is going to be the access to our community, which you can chat in there anytime, send me direct messages. You can put in the Q&A anything that you have during the course of the week. You'll get all of our education content. So you'll have handouts, you'll have PowerPoints, and you also have the option to request anything you would like. So if you said, hey, I really need to learn about liver disease, I will have it for you. So that is really the goal of the mentorship. And then, of course, the one live class a week. And then the other option is everything would be the same, except you also have the opportunity to do a one-on-one session. So that is where we can get really specific and just figure out what you need, what's going to help you be the best practitioner that you can be.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.